where community state type number 1 in Roman number corresponds to low richness in terms of microbiota and precise dominance with Lactobacillus crispatus, genus and species in terms of bacterial strain. Then community state type 2, low richness, but dominance from Lactobacillus gasseri. Community state type 3, intermediate richness, but dominance expressed by Lactobacillus iners. And number 5, allow me to skip just for a while the number 4. Number 5, in terms of community state type, low richness and dominance of Lactobacillus jenseni. Along with these 4 type of community groups, bacterial community groups, dominated by a peculiar type of Lactobacillus, Jacques Ravel demonstrated that some women do not have a very rich community group containing Lactobacillus, but demonstrated that these women can be represented by a bacterial community group with poor or no Lactobacillus at all, most of times poor Lactobacillus in terms of quantity, and the dominance expressed by putative pathogens. In that paper, on Proceeding of the National Academy of Science, Jacques Ravel demonstrated also that there are some Lactobacillus-dominated microbiotas that are frequently expressed like that. And this corresponds to the European and North American white women, and also the Asiatic one. Instead, Black women and Hispanic women were mostly dominated by Lactobacillus, by not Lactobacillus-dominated microbiotas. As a matter of fact, in such a women, the CST4 normally is represents between 38 and 45% of women. Always in the first seminar, we have described that it's possible to evaluate the obstetric gynecological risk of a woman simply after classifying her according to the community state type. This means that the CST1 is the community group representing women with the lowest obstetric gynecological risk. CST2 and 5, the 2 community groups represented by Lactobacillus gasseri and Lactobacillus jenseni, correspond to a sort of low, but not the lowest risk in terms of obstetric and gynecological risk. Then there is a sort of intermediate type of risk. This corresponds to community group number 3, dominated by iners, and then the community state type number 4 can be split in a subtype A and a subtype B, and these 2 represent the highest obstetric gynecological risk, being the CST4 type B the worst. We have also, let's say, tried to understand why the bacterial community represented by low richness and high dominance from Lactobacillus crispatus corresponds to those women who are, let's say, the most protected one in terms of a vaginal disease. Well, scientific community consider Lactobacillus crispatus strain, I would say the 85% of all the Lactobacillus crispatus strains so far found in the world, peculiarly protective because they are endowed with the pullulanase, that is an enzyme allowing these species of bacteria to obtain lactic acid without let's say the role played by estrogen. Then this type of bacterial cell are well-known high producer of lactic acid in destrogiric form, D-lactic acid, being D-lactic acid much more active than L-levogyr lactic acid. Then this type of bacterial species can produce protonated lactic acid, and protonated in comparison with the anionic lactic acid is much more active. Then they are the strongest producer of hydrogen peroxide. Then they can, let's say, protect themselves to a sort of smooth layer that allow them to be protected from dehydration and poison coming from other type of bacterial cell. Then they are the best producer known inside the vaginal community group of bacteriocin, a sort of poisons that can kill putative pathogens like Mobiluncus, Prevotella, Atopobium, Gardnerella, and so on. And then Lactobacillus crispatus are the best in terms of lowering pH inside the vaginal environment, because this is the only condition where a community, bacterial community can, let's say, lower the pH below 4. Then, always in the first lesson, we have also said that because of this knowledge, we can think to a sort of right bag to put in the right place, where the right bag is Lactobacillus crispatus strains, and the right place is the vagina environment. But this is not the only way to operate, to facilitate the well-being in terms of vaginal community. According to the Mayo Clinic, that is one of the most important US hospital in the world, there is also a way to reach vagina by oral administration of the strain. This has been very well verified, and between 5 and 8 weeks after the first oral administration and after having passed through the stomach to the gut, reaching the rectum and sharing their presence along with vulva, well, a strain administered by oral route can reach vagina. So, new chapter. So what we can do? Well, the most important things at this time is to understand that we do not treat simply a woman with a Lactobacillus crispatus. I mean, an undefined Lactobacillus crispatus, because we can treat a woman with a very specific strain of Lactobacillus crispatus. So Lactobacillus crispatus just describe a genus and the species in terms of bacterial cell, but do not add any things concerning the peculiarity of the individual bacterial cell. The individual bacterial cell is what we call the strain. And I would like to spend some words describing the strain called M247. Why? Because in terms of medical application, I really need, after having understood that if Lactobacillus dominated microbiota are the most protected one for the vaginal and women health, and after having understood that I can treat possibly a woman with a Lactobacillus crispatus strain, to try to make an attempt to modify the community group in a positive way for such a woman, I have to pose a new question. Which individual bacterial cell belonging to the genus and the species Lactobacillus crispatus we are talking about have I used? Well, in order to make a proper answer to this question, we have to ask to the scientific community which are the most documented and clinically tested strain belonging to the Lactobacillus crispatus species. Well, if you can ask such a things to, for instance, the PubMed community, well, the strain called CTV05 is probably the most investigated one. So far, I did this research yesterday. PubMed reports 22 study describing the role of CTV05. The problem with this product is that belong to a pharmaceutical company, an American pharmaceutical company named Ozel, as you can see in the right side of this slide. And Ozel Pharmaceutical is a sort of, let's say, research center that do not, let's say, commercialize and trade anything. It's just a research company devoted to make studies without transforming that in something useful for the clinical application. And as a matter of fact, as you can see right here, by reading the name Lactinvu, that's the name of a hypothetical product containing the strain CTV05, is just in phases of research and have never reached the commerciality. So there's no way out for anyone in Italy, in US, but also in Hungary to use it, the so far most investigated strain of Lactobacillus crispatus. So what do we do? Well, if we call the AI, I guess that most of you practically applied this possibility, asking for to Copilot or ChatGPT or things like that in order to get some information. Well, this morning, as you can see here, this is a screenshot of my laptop this morning, screenshot. As you can see, I posed this question to the AI. Which are the PubMed most investigated and also commercially available strains of Lactobacillus crispatus? And as you can see, the AI answered personally to me. You can see the answer, great question, Francesco. Francesco is my name. And as you can see, AI answered me that among the most studies and commercially available, because if I am a medical doctor, I need something available to treat a woman, but anyway, documented at the same time, L. crispatus M247 is the most investigated and commercially available strain of Lactobacillus crispatus. And as a matter of fact, if I go on PubMed, according to yesterday, PubMed reports 11 results. Most of them are all clinical trial. Well, so what does it mean, M247? M stands for the initial of the donor's name. It was a boy born about 40 years back from a vaginal delivery. So some researchers collected the strain from the stool of this boy, and the stool was contaminated by the vaginal secretion of his man. 247 stands instead for the number of isolated bacterial colony. 247 means that many colonies has been tried to grow in lab before getting one colony really performing. This means that, generally speaking, Lactobacillus crispatus as a bacterial species is quite difficult to cultivate. And this also allows you to understand why Lactobacillus crispatus strains are not so common all over the world, because they are very difficult to isolate, but most importantly, are very difficult to grow and to fermentate. Lactobacillus crispatus M247 has been deeply characterized in terms of probiotic property, and I'm about to show you some very very specific results. For instance, on the left side of the slide, this is the attempt to evaluate the antibiotic sensitivity profile of the strain. As you probably know quite well, the EFSA authorities in Europe say that for being commercialized, the probiotic need to demonstrate its total antibiotic sensitivity. This doesn't mean that the probiotics could be dangerous in case of directly dangerous in terms of antibiotic resistance profile. But if this antibiotic resistance profile can be transferred to some putative pathogenic, bacterial cell, you can understand that this would be a big mess in terms of health. So in case of antibiotic resistance, peculiar profile, we have to demonstrate that this resistance is not transferable, is not located on a peculiar gene basis. As you can see from the table in the left side of the slides, according to the EFSA guideline, for the most important antibiotic, M247 is completely sensible. According to the EFSA guideline, some of the antibiotics are not mandatory to be checked. Along with this, we have, for instance, metronidazole, sulfamethoxazole, and trimethoprim. Why I have listed these three? Metronidazole is also underlined with a red line, because the profile of this bacterial cell say that the M247 is resistant to trimethoprim, metronidazole, sulfamethoxazole. This means that in case you are going to be using an antibiotic of these three, well, the strain will be not killed. And this means that this antibiotic resistance profile is not transferable to any bacterial cell else. So it's just a peculiar capability of such a strain. I guess it's very important to know, for instance, that the strain is metronidazole resistance, because metronidazole is one of the most commonly used antibiotic for vaginal and oral application, but anyway, for the well-being of vagina and well-being of women. One more thing, M247 is also strongly resistant to boric acid. Boric acid is a molecule that is commonly used to treat recurrent candidosis. So it's important to know that using boric acid will not affect at all the strain you are currently administering to your women. And this is also valuable for the three antibiotics I've just told you. Another portion of the slide here below describe the percent of adhesion in terms of number of cells to the HeLa cell. So bacterial cell, 72% of the bacterial cell result to be attached strongly to the HeLa cell. The HeLa cell are the cell representing the vaginal mucosa. So this means that by reaching directly vagina with the local application of the strain, or by reaching the vagina mucosa after the oral administration, anyway, from a theoretical point of view, most of the bacterial cell reaching this environment should be engrafting, should be colonizing. Of course, we have also investigated deeply what happened to the bacterial cell M247 after oral administration in terms of enteric passage, because before reaching vulva and then vagina, the strain has to, let's say, allow to be alive and colonizing even the intestinal cell. And as far as what we know, after administering M247 to a woman in order to get the vagina colonization, well, the bacterial cell work in a positive way for that guest, for its host, because, for instance, it reduces the number of toll-like receptor number 4 that are the receptor that allow pathogenic bacterial cell to grow up, like, for instance, Escherichia coli, and increase the role played by toll-like receptor number 2. That is a way used by the enterocyte to strengthen the tight junction, limiting the permeability feature of the gut. So this means that even if this will be not your main target. Your main target would be to treat women with such a cell. Anyway, during the gut passage, the strain will allow, let's say, a sort of anti-inflammatory action in the gut of the human host, the women. This is the a picture concerning the gel for DNA electrophoresis, describing that after 14 days in blue colors and after 21 days in red color, most of the women treated by oral route with the M247 demonstrate the presence of M247, the strain, inside the gut. As you can see, after 14 days, 6 out of 9 the subject treated resulted to be gut colonized. And after 1 week more, 7 subjects out of 9 demonstrated to be engrafted with M247. This means that day by day, you can reach a higher value of colonies demonstrable inside the gut. And this allows you also to understand that this is the real road followed after oral route by the strain. But first need to colonize the gut. But the most important things is the vaginal check that we can do in order to see if and when the strain M247 move itself from the rectum to the vaginal environment. For instance, this is an evaluation that we have done after 6 weeks, and this image describes the vaginal presence of M247 inside the vagina, of course, but after oral administration. As you can see, after 6 weeks, most of the treated women have been colonized. I want to underline a thing that probably is not so clear to everybody. This doesn't mean that we have found Lactobacillus crispatus in such a woman, because you know, a woman treated could be already colonized by her own Lactobacillus crispatus strain. The image presented in such a slide show you that the strain M247 was alive inside such a woman, demonstrating that the tool that you as a medical doctor decided to apply to your patients really engraft vagina. Of course, this is also visible as a vaginal checking after vaginal administration. For instance, the subject D was untreated, and as you can see, the probe revealing the presence of M247 is absent right here. Instead, the subject E and the subject F are completely in any portion of their vaginal cavity, resulted to be deeply colonized once again, not by Lactobacillus crispatus, but by Lactobacillus crispatus M247, corresponding to the individual bacterial cell that you administer to your patient. Another question, after having understood that one of the most investigated strain and also commercially available Lactobacillus crispatus is M247, and after having understood that after local and oral treatment, you can reach and positively engraft your vagina target, well, we have to share some findings concerning the quality of the product, because the best results can be got if the strain is really alive inside your final tool, your product, and if this strain is also at a very high level of content of billion of living cells. This is a paper that I published in 2019 on microorganisms. And in such a paper, I wanted to compare the quality of different European Lactobacillus crispatus strain in terms, I'm talking not about documentation, because as I told you before, just M247, among this long list of strain, I can tell you really just the strain M247 is documented on PubMed or on Google Scholar. But this table represents a different type of information. I want to look for the quality product and the real content at the expire date. As you can see here, where I wrote NG, NG stands for not growing, meaning that inside this finished product, there was no Lactobacillus crispatus at all, even if the manufacturer declared billion of living cell, but there was nothing inside. Instead, in let's say 5 cases, I didn't write not growing, but I reported a number. This number corresponds for the M247 to 24 billion living cell per dose. In the case of LBV10, corresponds to 2.1 billion, so 1/10 of living cell at the expire date. And for the other 3 products, you can see here as IP followed by a number and the KS. Well, I found 63 million living cell, 35 million living cell, and 50 million living cell. You know, million is 1,000 times less than the minimum dosage to get a clinical result, meaning that just if you use billion of living cell, you have, let's say, you can follow the hope to get a sort of engraftment. So also this paper demonstrated not only that M247 is the most documented and commercially available type of strain, but it also at least at the level of European products available, the best quality one. Many papers has been published on M247 for vaginal well-being. It's not that easy for me to make the very long list of that. But I can spend just a few words on the last papers done on M247. Was all published on 2023, and concerning the use of M247 to improve the outcomes in women undergoing IVF. So this was women affected by problems of fertility. Well, 3 months of treatment versus control produced an increase in terms of clinical pregnancy by about 40%. Clinical pregnancy rate just by using blastocyst, pretty 90% more than control. Live birth, total, any types of approach, more than 66% more than the control. And live birth using the technique of embryo transfer at the at 5th day, like what I said before, blastocyst, 200% more than the control. And if you also check the odd ratio to get a pregnancy or a live birth, well, value are quite nice, because to get pregnancy is no less than 50% more, and the odd ratio to get live birth is no less than 76% more. Well, this was just to let you have a general overview on the role and the papers published on M247. Well, but I would like to spend much more words on the main focus of this second lesson, that is the protective role of M247 in terms of specific pathology. Before to start with the findings that we found by using the Lactobacillus crispatus M247 in protecting women, I would like to spend some words describing the relationship existing between the community state type 1 and the HPV, and all the focus of the remaining part of this presentation will be about HPV results. As you know, HPV is a virus, let's say, a big number of viruses, more than 100 so far, affecting the skin and the genital or oral mucosa. 40 of them are sexually transmitted, and between 12 and 15, according to the different researchers, can cause cancer. The worst strain are the so-called high-risk strain that all of you know quite well, are the number 16 and the 18. And today we can use a good vaccine that anyway has been manufactured by using just 9 strains out of the 15 that could provoke cervical cancer. So vaccine is a good strategy, but cannot protect all women, of course. HPV infection is something that could progress in a woman in months and years after the infection with HPV, but as all of you knows quite well, can also follow a different type of path that we call regression. And regression, meaning clearance, is can occur, let's say, spontaneously. But why I pose my interest in the relationship between vaginal microbiota and HPV? Well, because according to many papers published in the last 10 years, there is a strong relationship between the HPV prevalence by age and the vaginal microbiota features. If you can see from this graph, between 20 and 25, of age, and between 51 and 55, if we consider the high-risk strain, 16 and 18, well, we have a peak of infection. Why? Well, we think that between 20 and 25, this could correspond to the time, the window of time where a woman start to have frequently sexual intercourse. And as you know, and I have explained in the last lesson, this means that this could affect the structure of the vaginal microbiota. And between 51 and 55, the microbiota could change because of the arrival of the menopause. So because of this strong relationship, somebody start thinking that there could be also a clinical relationship between these two aspects of life, HPV infection and vaginal microbiota. And as a matter of fact, Professor Di Paola in 2017 published the first correlation between the vaginal microbial cluster and HPV presence. As you can see from the left side of this graphical abstract, the healthy control are most Lactobacillus dominated and peculiarly are dominated in terms of CST1. Instead, in the middle of the slide, where the women with HPV positivity, well, they start to be enlarged in terms of CST4, and CST1 as a percentage of presence start to be reduced. The worst is if we check vaginal microbiota community group in persistent, having no natural clearance for HPV. As a matter of fact, the number of women Lactobacillus dominated narrow furtherly, and the CST1 narrow furtherly. Instead, more than 50% of all those women belong to the community state type 4. Many other papers have investigated this clinical relationship. And as you can see, by following the reduced length of the green bar, well, the best, representing Lactobacillus crispatus, the best is found in HPV negative women. This value tend to be lower because of positivity, and in case of low-grade disease in vagina, like SIL. And normally the content of Lactobacillus crispatus is completely absent in women with cervical cancer. The same if we check on the left side, on the right side of the slide, what we call the Shannon index, the richness evaluation of this community group. And once again, there is a strong relationship with microbiota, meaning that the more you are affected by HPV or disease connected with HPV positivity till condition of cervical cancer, the worse is your richness. Remember that in vaginal microbiota, the best richness is a very low richness profile. Other information, if we check what was published recently on Nature, well, they have calculated the capability to clear HPV spontaneously, just in case you are Lactobacillus dominated, and especially if you are dominated by community state type number 1, being dominated by Lactobacillus crispatus. And as you can see from the right side of the slide, the clearance commonly occur 7 months earlier than in case you are not dominated by Lactobacillus crispatus. And current oncology reports in 2021 reported that having a Lactobacillus crispatus community state type may be protective against development of invasive cervical cancer in women with high-grade cervical dysplasia. Some other authors has also calculated the risk of get HPV infection or the risk of getting cancer in case you are CST4 versus being CST1. And in both cases, the risk is increased by 3 to 5 times more, meaning that being Lactobacillus crispatus dominated reduced by 1/3, 1/5 the risk of getting HPV, or worse, the risk of getting cervical cancer. After having detailed in such an extent the relationship between being Lactobacillus dominated and HPV, I want to spend some words on the relationship between M247 and HPV. This is the first paper published worldwide concerning the consequence of the oral administration of a strain, in such a case, again, M247, in women affected by HPV. As you can see from this table, most of the 35 women enrolled, this was a paper without a control group, so it was a very preliminary information. But as you can see from the red square, in this column right here, most of women were infected by HR positive HPV, and their community state type was mostly number 4 or number 3. Well, after 90 days of M247 treatment by oral route, 70% of such a women become negative, and most of them moved towards a community state type number 1. I want to show you the detailed results of 3 women, number 3, number 9, number 18. This is the subject number 3. Before being treated with M247, you can see the richness was quite high. The content of Lactobacillus was also quite high, but they were mostly Lactobacillus iners, meaning not protective at all. After 90 days, the richness dropped down. The content of Lactobacillus rised up to 100%, and this Lactobacillus community was mostly due to Lactobacillus crispatus presence. This is subject 9. Once again, before starting the treatment, high richness. In such a case, this woman is a CST4, meaning no Lactobacillus at all. And you can see this woman was dominated by Streptococcus at more than 60% of their vaginal content, more than 17% of Anaerococcus, 7% of Corynebacterium, 7% of Finegoldia, and so on. After 90 days of treatment, richness dropped down. The whole content of bacterial cell transformed in Lactobacillus as a genus, and as a species was 100% Lactobacillus crispatus, with no other types of bacteria inside. This is the subject 18. high richness at the very beginning of the trial, no Lactobacillus content, such a small content, as you can see here, campione meaning sample, the sample of analysis, was mainly because of Lactobacillus iners, not protective at all once again, and such a women were dominated by this couple of putative pathogen, Gardnerella and Atopobium. After 90 days, once again, the richness dropped down. The content of Lactobacillus was very high, proximate to 100%. These were all Lactobacillus crispatus, and no other pathogen was found. This paper that I have explained to you in details was also described and told by Lancet Microbe in 2023. Such an authors report the genital tract microbiota composition profile according to the use of probiotic in gynecological cancer prevention. They, at the end, decided to evaluate 105 studies that included in their meta-analysis. And as I was telling you before, they decided to describe the paper told before, some slides earlier. You see only one study by myself, sorry for this citation, and colleague demonstrated that after 3 months of treatment with M247, most of the women taking part to the trial become dominated by Lactobacillus crispatus and clear from HPV. Another group of research try to control, to repeat such a first trial. They enrolled 160 women affected by SIN1 and HPV infection. They evaluated the role played by M247 in improving versus control the clearance of HPV, evaluating the results after 12 months. But 12 months was the ending point. Anyway, the group of treated women was treated by oral route just for 3 months. Well, this paper confirmed the goodness of the first trial in terms of results, demonstrating that versus control group, the clearance was increased after 9 months of washout and 3 months of treatment by 20%. Currently, there is another paper that is about to be published. This is a randomized multi-center placebo-controlled trial where women were subject with HPV-HR infection to the treatment with M247. This paper has been recently submitted to scientific reports of the Nature group. And according to the results that I really hope to be soon published, the percent of HPV negative patients after 4 months of treatment with M247 was 60% versus 31% of the placebo group. And if we check the results in terms of pap test, evaluating, for instance, women with the ASCUS or low SIL diagnosis, where they were at the end of the treatment 5% in the probiotic group, meaning women treated with M247 versus 9% of the placebo group. Once again, the same way as we have told in terms of HPV negative patients, well, the probiotic treatment reduced or improved by 50% the results observed in the control group. If we check the correlation between the HPV clearance, the richness, Lactobacillus content, and Lactobacillus crispatus content in women who performed also the vaginal microbiota analysis, well, these results demonstrate quite well that the HPV clearance correlate statistically with the richness and statistically with the Lactobacillus crispatus dominant community group, but not with Lactobacillus itself. Why? Because when we evaluate the so-called Lactobacillus content, we are women having Lactobacillus iners, and these are not protected at all. These normally are women with the prodromic effect to maintain HPV without clearing from itself. So this means that this result is very specific for the Lactobacillus crispatus. If we also evaluate the relative percentage of Lactobacillus crispatus in patients who remained HPV positive or who became HPV negative in the probiotic and the placebo group, well, we can observe a sort of increase, a higher increase, especially in women who become HPV negative. But anyway, I want to show you that also in the placebo group, women becoming HPV spontaneously, negative, well, they demonstrated in comparison with those who remained positive an increased value of Lactobacillus crispatus independently from the treatment. This means that treating women with M247 has improved the community group and has allowed the HPV clearance. But also in the placebo group, women that accidentally who can become CST1 are, let's say, have a sort of advantage in becoming HPV negative. Then if we check the CST classification of the enrolled women at the enrollment, and after 4 months of treatment, well, we can see that in the placebo group, we had 6 CST1, but after 4 months of placebo treatment, CST1 was in 4 women. If we check in the probiotic group, we had 6 women in CST1, but after 4 months, they become 15. This once again means that the treatment provoke an engraftment of the strain, an improvement in terms of number of women being community state type 1, meaning protected one. And also if we check the number of patients with CST1, we found a strong increase in the probiotic group and not increase at all in the placebo group. As a 5th chapter, we can ask ourselves if we know the anti-HPV mechanism of action of Lactobacillus crispatus. Well, M247 is a strong producer of lactic acid in protonated form, and this is a strong bactericidal and virucidal action. Instead of, for instance, CST3, who is not able pretty at all in producing protonated form of lactic acid, but mainly this community group produce lactic acid in anionic form. Then Lactobacillus crispatus is a strongly producer of D-lactic acid. And D-lactic acid reduces the release of metal proteases, and this reduces the inflammatory phenomena that support the infectivity of virus at the vaginal mucosal level and cell. This is another strong ability to protect the women. Then, as nature said, Lactobacillus crispatus is able to, let's say, into brackets, manufacture extracellular vesicle that, for instance, cheat HEV and HIV. And this probably is also a sort of cheating effect versus HPV. And then we know that the microbiome can produce a sort of immunosuppression at the level of the vaginal environment. This do not occur when Lactobacillus is dominating, and especially when Lactobacillus crispatus is dominating this community group. At the opposite, when Lactobacillus is not dominant at all and CST4 dominant as a community group, well, a sort of immunosuppression, a sort of M2 type of immunity response is produced, and this do not protect at all women from HPV. Well, in these 2 lessons, I guess that I have said many things, and it's very difficult to sum up some take-home message. Well, I would say that we have clearly shown that vagina contains 5 possible bacterial community that we call CST. CST1, strong dominance of Lactobacillus crispatus and very low biodiversity, predisposes to better obstetric gynecological well-being for the host. The strain most investigated and also commercially available is Lactobacillus crispatus M247. This has been developed in form of finished product named CRISPACT. And then CRISPACT M247 has been shown to promote a better viral clearance in women affected by HPV in comparison with untreated women or in comparison with placebo-treated women. Just for your knowledge, this is the images corresponding to the CRISPACT product that I hope that very soon will be available for your use as medical doctors.